Hi Tammy, I'm Judith Whiteman, the perioperative nurse for Aaron Smith. I'm ready to give you a report so that you can provide post-op care to Aaron. As far as the situation, Aaron is a 15-year-old male who is 1 hour post-op from pectus excavatum repair surgery. He received general anesthesia and an epidural. He had 2 bars placed to stabilize his sternum and take the pressure off of his heart and lungs. The surgery lasted for 2.5 hours. He tolerated the procedure well and had no complications during surgery. As far as his background, Aaron traveled here with his parents from Peru. His first language is Spanish and he does not speak English, nor do his parents. He was born with pectus excavatum and has done well until now and had no treatment for it before now. But as he was going through puberty, he was experiencing more fatigue and dyspnea on exertion, so his parents sought treatment at our hospital. He has no other health conditions and no known allergies. He was wearing glasses and a watch on arrival at the OR. These items were sent with his parents, who are now in the waiting room. As far as his assessments, his most recent vital signs are within normal limits. Pulse 82, blood pressure 118/75, respiratory rate 15, temperature 98.9 degrees Fahrenheit, oxygen saturation 98%. He has not woken up yet, so I do not have a pain rating from him, but the epidural is providing localized anesthesia to the thoracic area and will probably be in place for several more days. He has 2 bandaged incisions on either side of his chest. His surgeon wants these coverings left in place for now. Aaron received 1 unit of packed red blood cells during the surgery and tolerated this well. He has a Foley catheter in place and I just emptied the collection bag. His output was 300 milliliters of clear urine. He has 2 IVs placed. One is in the left antecubital area and the other is in his right forearm. We are currently infusing 1 liter of lactated ringers and 2 grams of cefazolin in 50 milligrams normal saline into the left arm IV site. The right arm IV site is saline locked. His next dose of cefazolin is due in 8 hours. No other medications are prescribed at this time. As far as my recommendations are for you to monitor Aaron's breathing, level of consciousness, intake and output, bleeding around the surgical sites, and his pain level. He should lie supine for the first 2 hours from the time he wakes up. Then you could check with his provider about activity and movement restrictions. I believe the Spanish-English interpreter is in the waiting area with Aaron's parents. You will want to have her at the bedside with you when Aaron wakes up. Do you have any questions for me? Okay, now that I've listened to your questions about Aaron, let me repeat back what I heard and try to answer those questions. Thank you.